procedures immediately.
That's the beauty of nephrologists. You do the procedure, send him for dialysis. He's done.
Assuming I've given the local.
That's right.
Starting with
Okay, so if you stop here, stay like that. Remember, the assistants are, for this procedure, look at me, I'm his assistant, and my assistants at the University of Miami were like that. I wanted them to be part of me, just one team. So, look, he's blocking my view to go inside the needle. It should be swift. The steps should be like a dance. You see, this is how it should be. So I would come from here and I would have it in here. Are you inside the vessel?
No.
Okay. So here's the take it now. And I don't do this. I am always writing like that.
Why?
Huh?
Can I ask why? Just
like
for
this?
technique.
I don't know. I don't know. I don't like to beg. Like that, I don't like it. I like it like this. I like to go from the top, you know. All right. So you're in now. You see the wire going in?
Yes.
Okay, good. So push it in a little bit more so it doesn't come out, right? Okay, so now you can give me that needle. That's good enough. So now look at what he's holding. But the patient is bleeding, so it's a good idea to have the finger here. So go ahead, like that, hold the wire, and then I take the needle. Put the needle here, and I give you this. Here you go. Oh, that's okay, forget about that, because it's usually the assistant gives you that. And the assistant holds the wire.
Hold the wire.
Go in, way in, so you don't have the fear of falling out. Okay. Now, open it. And I'm going to... So hold it like a cigarette now, remember? Like that, and the thumb will...
I'm not a smoker, by the way.
Go ahead. So then you need to learn how to smoke. Come on, this is not acceptable. You mean you don't smoke?
I don't.
That's not right.
Interventional.
Okay, so you got that, and now. So what's the next step now? What do you need?
The guide wire.
Contrast, right? So we need to look. There you go. Here's your contrast. So now you've done that, and you see the stenosis, right? Imagine that this is contrast. Okay. So now, what do you need?
The guide wire.
Okay, so now you've seen the problem. He needs to fix it, right? Okay, so here's your wire. Okay, so keep going.
I'm beyond these.
That's okay. So you need to be way beyond the stenosis. You see the wire coming down here. That's to say that you got to go way beyond it, so you don't pull it out. Okay. So now, what are you going to do?
The sheath.
You want me to give you the sheath? Where's the sheath? Give you the sheath?
No.
No. Okay. Good. Good. You have to remove that. Okay, so now, what do you need? Okay, here you go. I'll hold the wire. You go ahead and place your sheath. I got the wire, and this is a good assistant would hold it here and would bring it like that all the way to the skin. Once on the skin, the patient won't bleed. So you're in, snap that, it snaps. So go ahead, take that out, hold the wire. two hands always. The wire is held like this. Like this. Okay. So we have the wire across the lesion. Anything you want to do at this point?
To be sure.
Huh?
Angiogram again.
Inject to be sure? Okay, so here you go. Here's your angiogram.
So 3 angio.
I think so, yeah.
Angio, 3 angio.
At least 3. Some people are really angio happy and they keep squirting, you know. That's okay. It's like, you know, have you seen National Geographic Channel? You have those cobra snakes. They keep injecting. Somebody should tell them, no, it's enough. And they spit also, right? You seen that? It's really scary. Okay, so now what are you going to do?
Need the balloon now.
You need the balloon now. Okay. So let's pick a balloon. I'm going to give you this balloon that I used. You can do it better than me. Remember, little by little is the best way. Okay. Ready to go in and do angioplasty? No, that's a mistake, right? You need to make sure that you have given the wire to the assistant.
It goes then, yeah.
And the assistant will say, I got it. So go ahead. Go in. Little by little. Little by little. Don't hold it here. Just little by little like that. Because it's a plastic, so it rubs on that. It doesn't go in good. Okay, so ready?
Yes.
Okay, so that's okay. We can do it right here. It gets stuck sometimes. Okay, so here we inflate it, and you see the balloon coming up, right? That's the inflation. And then you deflate it, and you're ready to come out.
Now that's the way. Inflate and deflate if you want.
Huh?
Inflate for 30 seconds.
Yeah.
And see.
And then deflate.
Deflate, yeah.
Deflate.
After 30 seconds.
Yeah.
Deflate. If you want to redo, inflate again and deflate.
Okay, so you see there's the stenosis. You've done the inflation. Sometimes I leave the balloon right there, deflate it, and I do a shot. Just in case if I need to do it, I don't need to put the balloon back in. I just come back, park it right there next to the stenosis, shoot, die. If it's good, I take it out. If it's not, then all I got to do is just push it a little bit more and do angioplasty, right? Mm-hmm. Okay. So, good?
Good.
So, our results look good. So, we're going to finish the case, so go ahead.
Another one.
Good. So, balloon is out.
Angio again.
Huh?
Angio again. After.
Sure. Absolutely.
Yeah. So I can do it before or after taking out the balloon.
I do it before I take out the balloon, but this is fine too. Sometimes I put the balloon here. If I don't want the balloon just sitting inside, I just come out here. So angiogram looks good. No bleeding, nothing. Now, what do you do?
Everything out.
Retract the wire.
Should we have taken the wire out before doing the angiogram?
No.
Not at all. Not at all.
Because
Wire is the last thing that comes out when you're completely satisfied, no hematomas, no perforation, no nothing. You say, this is the time I'm going to take the wire out. Okay, so now we can take the wire out. Okay, so wire is out. Now, what are you going to do?
Huh? She can take it away, or just she said, or just put it away.
Okay, so since you don't know, you don't need to put the dilator in. So what I do is I give local here, give a little bit local here, and I take a stitch here, I take a bite here, I put the knot, and as I tighten the knot, I put my finger here,
So,
and the assistant tightens it.
Percutaneous?
Yeah,
so you're suturing the skin,
suturing the skin.
not the vessel. Of course.
Very good. I am impressed. You're suturing the skin. The rest, your pressure 5 minutes will take care of it.
Okay.
Because you're not suturing the hole in the vessel. You can't. Not a good idea to do that. Okay, so let me do this this quiz now for you all. So you've all been here, right? You've all been listening to me, right? So I want you to come here. Darren,
Here in the last half of an hour now.
how you doing? You. She is trained.